February is American Heart Month, and all month long, News 18 is working with Franciscan Health to raise awareness about the importance of heart health. Today, News 18's Maddie D'Addario kicks off her coverage by taking a look at the most common type of treated heart arrhythmia, atrial fibrillation.
More than 2.7 million Americans a year, and yet many are unaware of what AFib is.
It's an abnormal rhythm in the top part of the heart. It's when the patient's heart goes usually fast and irregular, and that's what they usually feel.
Dr. Assem Rimawi, an interventional cardiologist with Franciscan Health Lafayette, works firsthand with patients who experience AFib. He says the most common symptoms are fatigue and tiredness, but there are other symptoms to look for as well.
Shortness of breath, feeling their heart is racing, dizziness. Rarely causes passing out. It could sometimes cause chest pain in some patients.
Dr. Rimawi says atrial fibrillation has hereditary predisposition, but lifestyle choices play a major role in suffering from an episode.
Alcohol consumption, lack of exercise and physical activity, and obesity increases the likelihood of atrial fibrillation.
One of the biggest concerns some doctors have with the heart condition is the complications it can lead to.
If the heart runs fast for a long period of time, it could weaken the heart, so it causes heart failure. It makes the heart inefficient because of the fast heart rate and irregularity, so that could cause heart failure with normal heart function. But the most important thing that we worry about the most is that it could cause increased blood clots, and that could lead to a stroke.
But if you do experience AFib, there are treatments available.
The treatment options include that we control the heart rate, or we try to resume or restart the normal rhythm. That would be done with cardioversion or shocking their heart, medications, or we also could do ablation, where we go in and burn or freeze areas in the heart to try to keep them in normal rhythm longer.
The medical field is also in the early stages of using wearables like Fitbits or Apple Watches to detect AFib in the heart, providing more accurate detection than they've seen in the past.
There were studies that were done with certain manufacturers that showed that they are pretty accurate in about 90% of the time in detecting atrial fibrillation. And currently there are some studies that is being done to see whether such detection would help aid change in treatment from what we knew before. Because in the past we assumed if you had atrial fibrillation once that you would have it more than we know about it. But now with wearables, we may know exactly how much you have.
But before treatment and detection comes prevention. While atrial fibrillation is not 100% preventable, there are things you can do to decrease the risk.
In some studies, they found that exercise and weight loss in a really kind of like a vigorous program may decrease the risk of atrial fibrillation as good as some other modalities of treatment. So it is important for our patients to maintain, healthy weight and diets and lifestyle.
Reporting for News 18, Maddie D'Addario.
And Dr. Rimawi says there are also tests available for people to check if their heart's in good shape. You can find those resources and more on our website at WLFI.com.